Okay, I will pretend that we're live. We're live. What's going on, D-Bags? Hope you guys are doing well. We're back here again with another episode of the Detox Podcast, episode 315 to be exact. I believe 315. If you're new here and enjoy music, podcasts, comedy, or hooping videos, do consider subscribing. We've got a whole bunch of that stuff going on around here. When you do subscribe, leave a like or hang out with us in the live chat like you're going to do today. Helps us share conversations and laughs like this with more people. So do consider doing that. Now, before I can introduce you guys to my guest this week, we got to talk a little bit about vacations. It's nice out in Wisconsin finally. We've got a few weeks. I don't know how long this is going to last. The seasons are shifting. The world is an interesting place right now, but you got to enjoy it while we've got it. And there's no better place to do it than with today's video sponsor, Alpine House 2. Alpine House 2 is a classic Swiss chalet duplex A-frame log cabin located up in Iron River, Michigan, right across the street from the Ski Brule Resort in Iron River, Michigan. Surrounded by forests, lakes, rivers, obviously Iron River. Alpine House 2 is the destination for fishing, hunting, hiking, snowmobiling. Well, not this time of year, snowmobiling, but kayaking and boating. It's crazy. You can see some of the pics and whatnot we have on screen. It's beautiful up there this time of the year. Alpine House 2 has been pretty consistently booked up over on Airbnb, but you should be able to catch them and send them a message. Tell them that Darren, Rita, Detox sent you, and they will set you guys up with a vacay. That's at Alpine House 2 on Instagram. If you want to reach out to them that way, that's at ALPINEHAUS number 2. You can stay up to date with renovations, bookings, and more. They're also linked down below, so you can check them out that way. Now, I did mention this with the 315th episode of the show, so we've been doing it for a while. When I was first starting out, there was plenty of hiccups, issues that I was running into technically. I had no idea what cameras to use, what mics to use, etc. And if I would have had today's other video sponsor in my back pocket, things would have been a little bit easier. That brings me to Impulse Cameras. Impulse Cameras is here to help you skip all of those headaches that I had to go through. Impulse is located in Oak Creek, Wisconsin's Drexel Square. They have everything you could possibly need for your creative projects, whether it's cameras, lights, microphones, gimbals, or even just a space to record your own content. They literally have all of it. But they don't just have great gear. They also have professionals that have been working in the field that can help you get the best gear suited for your needs at prices that actually fit your budget. And if you're not convinced, they've actually got a super legit rental program that allows you to get your hands on a select different gear before you do buy it. And they also offer monthly memberships to get discounts on gear, as well as access to an exclusive Discord. So they're linked down below, or you can check out at impulse.mke on Instagram or impulsecameras.com to see everything they got going on. One last time, that's impulsecameras.com or at impulse.mke. And like I said, they're linked down below. So shout out to Impulse and Alpine House 2 for sponsoring today's episode. Now, with all that good stuff out of the way, all the church announcements done, I'm excited to be kicking it with my guest this week. We've got to give a very wet detox welcome to urologist Gray Roberge. That's how you say it.
That is it.
That is it. What is a urologist?
Oh, well, thank you so much for having me.
Absolutely. There's people, I was joking with some friends of mine at basketball day. Yeah, I got a urologist on. They're like, what is that?
Yeah.
I'm like, well, I kind of know, but if you want to let our audience know.
So a urologist is a physician that takes care of all parts of the urinary tract in men and women, but there's also within the urinary, or I guess genitourinary tract is really the technical term, looking at things like, so there's urination problems, infertility, kidney stones, cancer. So there's a very, very wide range of medical and surgical interventions that we do.
Yeah. So do you do like, are you a surgeon too then?
Yeah.
Oh shit, dude.
Yeah.
That's scary a little bit.
It can be very, very stressful at times, but it's also very rewarding at times.
Yeah.
But it's
how'd you end up going that way?
Yeah.
Because that's something I'm curious. My sister's going to med school. I was joking with you
right.
in the elevator. She's starting in the fall. And I always wonder, I know plenty of people that work in the medical field, like, how do you end up getting sorted, like in Hogwarts, where like, does somebody come and be like, yeah, you should just do this, Gray? Or is it like, man, I want to do stuff with, genitals?
Yeah. That's
I guess
that's what usually people say. Yeah. It's like, oh, how did you decide that you just wanted to work with penises all the time? But I always tell people it's both men and women, because women have kidneys as well. But I think your first thing is, so when you go to medical school, your first 2 years are basically learning a little bit about every system and taking a more generalized set of boards. And then third year, you actually rotate on the different services, they call them. So you rotate on surgery, internal medicine, psychiatry, pediatrics, neurology, OBGYN. And that way you get to actually learn and see what you like. And I think usually the biggest choice people make is whether you like medicine or surgery. Because some people absolutely hate surgery. They hate being in the operating room. They hate standing for a long period of time. They just don't like the medicine or the pressures sometimes. And I don't say that disparagingly, but it's just some people like it, some people don't.
Yeah.
I loved it. And I like using my hands a lot. And the OR environment is fun. You get to work closely with your nurses and your team and your partners. And so that was for me. And then urology, though, is cool because you can never get bored with it, really. There's so much, whether you do infertility, whether you do stones, whether you do cancer, there's so much stuff and I liked the long-term patient relationships as well. So you look after people for a long time.
Yeah. Interesting. Was there ever anything else when you were doing those rotations that like you almost did, or you're like, oh, that was, close second maybe?
Sure. Yeah. So psychiatry, I originally wanted to go to med school for psychiatry. I really liked that. Luckily, there's a lot of psychiatry in urology.
Really?
Yeah. So the urinary tract is actually very intimately connected with the brain. So you work with a lot of people who urinating patterns or things like erectile dysfunction are often driven by psychologic concerns. Even things like premature ejaculation. You've got all sorts of wide range. So you are meeting people at this very kind of intimate moment in their lives and building hopefully a trusting relationship to take care of them.
Yeah. Oh, wow. I guess that makes sense when you say it that way. I didn't think of it off the top of my head. When you're in med school, what are other med school students like? What are the stereotypes? Like if somebody...
Yeah. Oh, man. They really run the gamut. They run the gamut from... they run the gamut from people who are very casual about everything and can just fly through and you're amazed just at their ability to pass and they never seem to study and they just crush exams and they're so good and it seems so effortless. You do get the really obnoxious people though. They're the so-called gunners, which are the people who are like they study all the time. They are just they want to be the absolute best, the top. They are fairly cutthroat.
Oh, okay. They're trying to be like a 1%. They're trying to like, is that healthy or is that like worth it? Like if you're getting a degree, like does it matter if you're the top percentage of your class or not?
No, I mean, so there's this stereotype, P equals MD. Like, so it's, and I think it's that med school is only one part of the equation.
Yeah.
There are some people that do really well in medical school, but they don't make good doctors or they burn out or they have issues as being physicians or they don't make it. Because after med school, you have to go through residency, which is the additional period of training that's 3 to 7 years, depending on for your specialty. Yeah. And that's when you are a doctor, but that's where I think you really are. Med school seems so quaint at that point, almost like it's so far away because med school, you're learning a lot, but you don't have ultimate responsibility of things as well. And residency, obviously, you have some cushion as well because you're not ultimately responsible. There's an attending physician above you, but you are taking care of patients. You are making decisions. Those patients and their concerns and their issues are so much more visceral and resonate with you. Yeah. So, but it's I think trying to be balanced is much healthier.
Is that normal for people, or does that happen often where people will get through med school and then like drop this shit in residency? Like they get to the residencies and they're just like, nah, I'm not doing this anymore.
Yeah, sometimes. Yeah.
Holy cow.
Yeah, I think it's not terribly common, but I think it's residency is brutal. Like it's
I believe
it's brutal.
I feel like the pressure, I mean, just knowing myself, like if I was to go that route and I had gone through all the other schooling and got my degree, gone through med school, and I got to residency, even if I hated it, I would be like, I got to stick this out. Like almost like a bad marriage. Like you got to stick it out for the kids. Like there's no way I'm this far in debt. Like I'm doing this and not, seeing it through. I think to really hate it.
Well, I mean, yeah, and the other thing is the debt that you talked about. It's just that you're so far in debt as well. I mean, that's just with our recent administration passing bills to limit student loans for professional schools, med schools, law schools. That's going to, I think, be even a more difficult issue as people take on more private debt. I don't mean to get political, but
also the mental side of that too. Like that's what like my sister and I, we've had conversations too, because she's about to be taking on all this debt, and she's like, well, I don't know how much of it. She was like nervous about when she should be applying and stuff like that, because she didn't know what was going to go through and what wasn't going to go through. And it's like, dude, that's gonna discourage some people from going that route, and even the people that do go that route. I imagine the mental strain of having that debt in the back of your mind or looming over you as you're going through this super important and difficult thing was already tough. I can't imagine it now when we're adding in more private debt like you're talking about.
So I originally was an English major and had to do a separate pre-med program on top of this. So, I mean, it took me a while to get here.
Yeah.
And so I had to go back and do all the requirements. And I had to take a bunch of private loans out for that. And that is a mess. Those private loan companies are just some of the cruelest people out there in terms of like coming after you. It's almost like bounty hunters coming after you for debt. Like if you don't submit this paperwork. I remember filing complaints with the Consumer Financial Protection Bureau, like when it existed, because
they just axed that too.
Yeah, exactly. Again, not to get political, but because sometimes they would claim they didn't get forms. Oh, you're not saying you're in school, so therefore you have to start paying it back. But I keep telling you I'm in school.
Yeah. Roughly how much do you think, or like in your experience, you don't have to give me like how much you were in debt if you don't want to, but like how much does it cost to get through med school to become a urologist, to become a doctor?
So I had like 20, I went to a University of California undergrad school. So I had about $20,000 of debt from undergrad. And then I think government loans was about $350K. And then I had a private loan as well that I think ended up being about $100K as well. So it's,
like $500,000 to become a doctor.
Well, so that's the thing, right?
Jesus.
So it's like, this whole concept, I know, of like a wealthy physician playing golf, and like it's like it's phenomenally expensive. Yeah. And it's only going to get worse for people, unfortunately.
Yeah.
And the downstream effects of that is that fewer people are going to go into quote unquote lower paying specialties like primary care. And because they just don't reimburse as well. And if you have people that are forced to take on limited government debt and private debt, I mean, it's going to be a mess.
Yeah.
There's a physician shortage already.
I was going to say, as if it already wasn't a mess.
Yeah, exactly.
It already is. So it's like, that's incredible. Wow.
So yeah, it's kind of it's I don't know. Yeah. The coming years are going to be a little bit worrisome. Especially as, as families get older and we have to think about taking care of our parents, and if you have kids, thinking about that for the future.
Yeah, it's scary because like I feel like it's already hard enough finding good doctors, like it's like people in the same way, like people will go through a few different therapists before you find the right therapist. Even like primary care physicians, like I had a couple in the last few years that sucked. I went to it and I was like, this was the worst experience I've ever had in my life. I literally don't have a primary care right now, because I just was like, the last two people I saw were like, this is so bad. I'm glad I got checked up, but I'm never coming back. Like,
well, and then you got to wait for people. I mean, it's kind of a nightmare. So I feel for you on that as well.
Yeah, it is a pain in the ass. You said something that was interesting about in med school, that P's equal MDs.
Yeah.
That's insane that there's another because C's get degrees is like the saying for us like normal college people, right? Sure. Like the fact that there's another level that's like B's get MDs, that's like that, you kind of slid that in there, and I don't want to pass by that. That's insane that you guys, do you get graded on like pass fail?
Yeah, so it depends. Certain med schools are different. Some still have grades, some still rank the class.
What does rank mean?
So ranking means that you are ranked 1 through X number of, so you know where you are in the hierarchy. So we were not fortunately where I went to med school, we were not ranked, which was awesome because it took away that pressure. And the first 2 years were pass fail.
Yeah.
So you don't have to worry about grades, so to speak, because you can perhaps, the issue with medical schools, unfortunately, is a lot of the curriculum that are taught, and this is a whole controversial point sometimes, is that sometimes what is taught in the curriculum isn't necessarily what is good for studying for the board exam necessarily.
Oh.
And I can see pluses and minuses both ways. So sometimes people, though, in a pass-fail medical school environment will try to just pass the exams, do well enough to graduate, but they're really constantly trying to study for the actual board, like so the standardized test that you take at the end of 2 years.
So they're not super focused on maybe day-to-day, week-to-week unit stuff, but they're like, as long as I'm passing this so I don't flunk out of school, and I'm ready for that.
Exactly, and ready for that, because unfortunately, and now this has changed since I went to medical school, because they made this exam now pass-fail, interestingly enough, the first board exam that you take, but previously the board score that you would have was very, very important in determining what specialty you go into. So after the first 2 years, people really, this is where you start seeing people really freaking out and getting very gunnerish, so to speak, is trying to study for this exam. It's called Step 1, because there's a Step 2 and then ultimately a Step 3. So after the first 2 years, this used to be that your score really determined what specialties conceivably you were eligible for, because some are quote unquote more competitive than others. And now it's pass-fail for the last few years. I don't remember exactly, but the thought is now you have to do more research or publish more papers, or then they put more weight maybe on the second step. So Step 2 is that which you take your fourth year of medical school.
Jeez, wow.
Yeah.
A lot of pressure.
So there's a lot of pressure,
to make it through all this. I mean, I guess that's good in a sense, right? That there's like we're making sure that people are well educated, but it seems like very cutthroat.
Yeah, it can be. I mean, it is. It's like, what's nice about it is that you just kind of have to study for the first 2 years. Like I had in undergrad, I had jobs and there's so much stuff going on, and you kind of just have a chance to study and just learn and enjoy the material. And that I miss quite a bit, actually, that thought, because when you're in residency and afterwards you are doing the day-to-day stuff and learning, but it's harder to just sit down and study and learn because there's not that designated learning time for it.
Mm-hmm. When you're kind of maneuvering your way through med school and going through these different stages, is there, when people start getting sorted into their specific specialties, are there stereotypes with different specialties? And what are some of them?
Yeah. Well, so it's just, so one of the big things is surgeons are assholes or dicks, basically. They need to be in control and freaking out in the operating room. They're getting divorced, 5 marriages, that kind of thing is the classic stereotype. Medicine and radiology are nerds because they like to obsess over patients' labs and look at X-rays and CT scans, and there's a lot of that, or like going into psychiatry. I always thought, because I have a bunch of issues myself that maybe I can fix myself potentially. So
but that going on.
Yeah, so it's those are kind of your main things, like medicine, internal medicine are kind of nerdy folk, and surgery, the stereotype. You don't really function well in humanity, and it's funny because you do see both, but I think that might be an older, more archaic stereotype, because you really see everyone exists in every specialty at this point here, and you can't really match the stereotypes, but it's still kind of fun to remember it.
I bet, and I'm sure that maybe there's a tiny bit of truth in them, but it's interesting. It does make sense when you think about it, like that. Of course, somebody who's a surgeon who's going to become that good at that thing would want to be a control for, would want to control every aspect of their life. So.
Yeah, and I think that's less, because as medicine is culturally shifting towards more balance now. I think I'm trying to remember exactly when. So don't remember exactly when, but in the 2010s at some point they started limiting work hours. So that's the amount of hours you can work as a resident. So that was limited to 80 hours a week, because previously people would work like 100, 120 hours. They called you a resident because you were a resident of the hospital.
Yeah, I mean, 80 is a lot, man.
Yeah,
That's
80 can be pretty terrible. But
Yeah.
And then of course the old grumbly guard there would say, "Oh, these kids are never going to learn because I had it so bad," and then because now you only did 80 hours a week, and which is kind of funny when you think about it.
Yeah.
And I think it's good. Like, work-life balance is now more important. It's still a problem, but I think at least societally for medicine, we're starting to recognize it.
Yeah, it makes sense. I mean, I know we kind of were talking earlier that there's a little bit of a shortage. I mean, well, not a little bit, a lot of a shortage when it comes to like doctors and nurses and stuff like that too. I think having stuff in place like that is only going to make quality of like care better. Because if you're fucking just, sleep deprived, over like burned out, like whatever, some grumpy piece of shit, like, you're not going to be making the best decisions. You're not going to be doing the best work you can do, especially like bedside manner, all these different things. Like, there's no way that's going to be top notch if you're
100% agree. I mean, they've looked at this. I mean, they've looked at like X number of hours of sleep deprivation is the equivalent of like driving intoxicated. I mean, one of my co-residents fell asleep at a traffic light. I remember like after being up all night and was being honked, and so there's that kind of stuff as well. They so the counterpoint of this, they have studied, and these studies are probably biased or skewed, that the more patient handoffs you have. So if you have someone coming in every 12 hours, let's say, and you're handing over patients, that may lead to more medical errors. So that is what, again, more of this old guard uses to promote, we need to be staying in the hospital for 36 hours, which is just not... No. It's not sustainable. I mean, I think that's like part of my problem was just I got really burnt out eventually with all of this when I was in my first job, and I mean that's kind of why leading to trying to do this whole comedy thing. But not to get ahead. But what your sister's going to med school?
She is.
Okay. Yeah. How old is she? Older, younger?
She's 24.
Okay.
24 now, yeah. So
does she know what she wants to do? Does she have any field of interest
specifically?
I don't think
so, no. I don't think she has a specific yet, no. She'll be mad at me if I'm forgetting, but I'm pretty sure because we all ask her, we're like, so what do you want to do? And she's like, don't ask. Don't ask me, bro.
No, it's exciting. I think she's going into it at a time where work-life balance is a lot more appreciated at this point here. Yeah. So, I mean, it's exciting. Good. She's probably really excited.
Yeah, I think she's trying to ball out as much as she can, I think, this summer until she's got to be locked in and she, be studying and whatnot. So it is what it is. But I'm interested, like, when you tell people, so, like, obviously, I have some questions that I want to talk about, you being a urologist and whatnot, and some of them will be a little silly here. But when you tell people, like, normally that you're a urologist, does that, like, garner any reaction, or do people, like, have any ideas in their head, or is it just like the penis thing? They're like,
so it's usually penises. Usually you just work with men. Usually I just don't tell people I'm a urologist.
I'm a doctor.
I usually say I'm an accountant or I'm in IT.
Okay, sure, yeah.
Because if you take Uber or something, sometimes I'll be in scrubs. I'll just say I'm in IT. Yeah.
Why?
Because the problem is I got in an Uber once. Someone was like, "Hey, can you look at this rash?" He was like, "I got this mole," and you're like, "Oh my god, really?" That's talk about work-life balance, right? Yeah. When you tell people you're a urologist, I mean, I have had
like, "Hey, can you look at this?"
And
pulling their pants down.
Some people will say they're like, "Hey, I've got X or Y," or you start talking about. I mean, I remember I was at the day after the wedding brunch at my youngest brother's wedding, and he was like, "Oh, talk to this woman, this guest at this wedding about prostate cancer, and her husband was going through prostate cancer treatment, and she wanted to know about surgery versus radiation," which is like that can be a very in-depth discussion and very personal and very if someone's going through cancer treatment, very frightening. So you run the gamut on it.
It's like, maybe I don't want to. I haven't seen this guy's prostate.
Exactly.
I don't
right,
want
and
to talk about it
it's different. So it's but yeah, mostly you get the penis related.
Stuff, yeah. Why go the route of the penis doctor?
So
what was it that was it the scoring or was there something else that you were like?
Yeah, I mean, I think so. You get to be a surgeon and a non-surgeon, so you see a lot of patients in clinic. So your day is very balanced. So I'll try to be in the operating room 1 to 2 times a week, and then you are the other times you're in clinic at that point.
What's it like doing when someone passes a kidney stone? I'm genuinely there's like 2 things I'm afraid of, and it's a hernia and getting a kidney stone.
Yeah.
I don't know why. I just those 2 things. I work out a lot, and like I've taken creatine. People will be like, "Oh, creatine, kidney stones, watch out!" Like da 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 da. Or the same thing with like lifting heavy. People will be like, "Oh, you gotta be careful. You could pop a hernia." And so like I'll have like a tight hip flexor, and I'm like, "Is it happening?" Like my biggest fear.
Sure.
So
yeah.
What is it when you see the kidney stone?
So kidney stones are the stereotype is it's worse than childbirth is what I've heard.
Yeah.
In childbirth, you get a baby at the end of it, and a kidney stone, you pass the stone. So it is pretty impressive. The pain. I haven't had one ever. People in my family have had them, and having seen plenty of them, is that sometimes the pain is you have to admit people to the hospital to control their pain, and then take them to surgery to get the stone out. God. Which is
it scares me.
So drink your fluid.
I drink. I mean, I get a gallon to a gallon and a half of water every
that's
day,
perfect.
so I should be okay.
Yeah.
Right.
So usually we like to say in our stone formers, just in general, like a general recommendation is 2 to 3 liters of urine per day. So it's about 64 to 96 ounces of urine per day, which is a lot of urine. You have to balance that with running to the bathroom all the time.
Yeah, I do pee a lot.
Exactly.
I do pee a lot.
So, I mean, if you don't have any medical condition that prevents you from drinking fluid, that's probably your number one weapon against stone formation.
What's like the most common reason that you've seen where people will maybe develop a kidney stone, or is there not? It's random.
Dehydration. Yeah, people just don't drink enough, and people like to say, "Oh, I drink so much," and then when it comes down to it, they're just really not. Like, it seems like you're drinking a lot, and
I know people that I don't think most people drink water at all.
Yeah, I've had people say I don't like water.
Dude, my roommates in college,
they not like water.
They only drink soda. They drank exclusively Coke from McDonald's, and that was it.
Oh yes.
And I was like, guys, you gotta drink slip a water in every once in a while.
Yeah.
Like, well, there's water in the Coke.
Yeah. So and that's interesting because some people say any liquid's good liquid. And I would always joke where it's like, because I was practicing in New Mexico before this, so I would say, you tell people 2 to 3 liters of fluid a day, and I would say I trained in Wisconsin, so they would say, well, 2 to 3 liters of beer a day sounds great to me, or something like that, and and you're like, no, you should kind of slip some water in there, man. But it's basically, they're very common. 1 in 10, 1 in 11 people have them. Yeah. And usually it's just invariably people just don't drink enough. I mean, we see it a lot in people working outside and like young people. So young people who get them, there can be family history. Some people have had them since they're kids.
Why does a stone go in? Why does it form? Just you're dehydrated and just rocks.
So it's like rock
spawning?
candy. Yeah. So basically your urine is super saturated with certain kind of mineral elements, and it's just, if you think of like a nice flowing river, you're going to dilute everything out. Whereas if it's just stagnant, tiny amount of urine, these crystals can precipitate or form in the urine there.
Whoa.
Yeah.
Yeah, that does sound awful.
It's pretty, and some people just have it really, some people, I mean, so there are congenital things that lead to stone formation. Family history is a big one, but a lot of the times they're spontaneous, and it's just people don't drink enough. Sounds like if you're drinking at least a gallon a day.
I should be okay for a little bit. Yeah,
so,
that's good.
I mean, I
get scared, man.
It's a good weapon to ward it off for sure.
Yeah. Wow. Is it something when people get one, is it like immediate? Like, I'm sure like it forms over time. But when it forms, is it like, immediately, like I have a kidney stone?
Not necessarily. So it's got to block something usually to make. So it forms in the part of the kidney called the collecting system. So the kidney's got 2 parts, kind of the meat of the kidney, so to speak, that makes the urine, and then the part that actually drains the urine through the urine tube, the ureter to the bladder. Yeah. So if it is stuck in the part of where it exits the kidney or that urine tube, that's where people will get that pain of it's actually. A lot of people think it's the like the stone scraping against the anatomy or the tube, but it's actually that stretch sensation that is extraordinarily painful because the kidney's blocked.
So does it hurts like where your kidney is then when you get one? It's not like a...
It can depend. Everyone's a little bit different. Okay. So generally people with a kidney stone that's higher up, you'll feel it kind of under your rib cage on one side or the other. For men, as it goes down, or women, you'll often feel radiating into the groin, the testicle, that kind of thing, as well as it's getting into the bladder. Yeah.
Damn. That's great. So you've seen a lot of these.
This is
most
it's I mean, this is like bread and butter for any or stones, because people are just.
What's the biggest one that you've seen?
So they can range from, it's interesting. This is a case where size doesn't really matter. I've seen like 2 and 3 millimeter stones. So like kind of just really, really tiny, like almost a grain of sand period at the end of a sentence, like a typewritten period. Really, really cause terrible, terrible issues and pain. But some people have like inches of stone in their kidneys, which is actually something called a staghorn calculus, because the way the shape is that it looks like an antler's horn, or it looks like antlers of a deer. Yeah.
I might does anybody just decide to opt to just die? Does anybody just go like, hey man, I'm not pissing an antler out of this?
It's an interesting decision, because there are times when you can die. So infected stones, like stones plus a urinary tract infection, is an emergency. Some people have only one kidney. That's an emergency where it's blocked. We like to take care of people who are, obviously, if you're a pilot or a bus driver, you don't want a pilot or a bus driver getting a kidney stone in the middle. So, but where you can have that is because the surgeries to remove stones that are so big, like the staghorn stones, usually it ends up you have to make a hole through someone's back and get the stone out with almost like a jackhammer, like a pneumatic and ultrasonic jackhammer from the back of the kidney. And that can be a pretty brutal surgery. So I have seen patients who are end of life, and this is a reason to. They sometimes have tubes in their back or tubes in their kidneys to drain them out. But yes, sometimes people just can't go through that surgery. Yeah, I mean, that's a big... So kidney stones are a big, big problem, and they can... I mean, most of the cases, though, are people who are like, oh, I passed a stone. I had one 10 years ago. I know what it's like. But they can be very, very, very debilitating or life-threatening for some people.
Yeah. It sounds like it. Yeah. Wow. Is there like a... like I've heard sometimes where people will be taking care of a patient who maybe they're an alcoholic or a bad smoker, and they're having issues with their lungs or they're having issues with their liver, and they get admitted to the hospital for that. And then like they leave or not even have left yet, and they're like sneaking a cig, like they're trying to rip a dart on their way out of the hospital. And you're like, yo, Betty, like we just saved you. Oh shit, we're breaking something. No, that's all right. We'll put the light back up in a sec.
I'm sorry.
You're fine.
I was just saying, I'm never going to be invited back.
No, you're good. So like, or they're like you end up pumping their stomach 2 weeks from now. Is there like a equivalent to that in urology where it's like something or a behavior aside from maybe just drinking water that like people do or don't do that's just kind of like frustrating for you as a...
Yeah, I mean, smoking's a big one. I mean, smoking is not so much for kidney stones, but for like bladder cancers, kidney cancers, urinary tract cancers. So people who have bladder cancer, kidney cancer will still smoke sometimes. So smoking cessation. With stones, it's a lot of it is like diet. So high salt diets or high animal protein diets can be. People don't eat a lot of fruits and vegetables, which are they help against stone formation. Yeah. So people will go back to their diet somehow. I think in urology though, it's they're two. So I guess the other smoking, and then people who are not taking, if their bladders are not working.
Yeah.
So there are a lot of conditions that predispose you to not actually be able to urinate spontaneously. So urination is something we take for granted, a lot of us. Yeah. And that's kind of why I like urologists, because everyone's got to urinate. And when you can't urinate, it's like it can be shameful. It can be life-threatening. It can be very, very challenging to manage. But there are some people that can't. They need to actually pass a catheter to drain their bladder every time they urinate. So you've ever watched like Fox News, like 3 a.m. you see all these catheter commercials, that's what they're for. But sometimes you have people who just they don't want to pass a catheter, and that actually really degrades their bladder further, causes an infection, hurts their kidneys. The other thing we're seeing more of now is something called ketamine cystitis. So I think when Elon was in the news, I think they mentioned this casually. That's
he was taking some shit, right?
Yeah, so he's taking ketamine, and they said cause problems with their bladder, and actually that can really, really. I don't see it as much here. I saw it more in New Mexico, but it's like young people can absolutely destroy their bladders. Their bladders can become like they can hold like maybe a shot glass worth of urine, and they hurts their kidneys, like because all that stuff backs up, and that can cause renal failure. So
yeah.
That can be hard in urology, is smoking and people who are not unobstructing themselves or actively hurt, that mean because sometimes people need transplant, like kidney transplants ultimately because of that. So you can watch people unfortunately hurt themselves.
Yeah. Wow. That's insane. So this is like from people that use ketamine.
Yeah. So a lot of that, yeah. So I mean,
I know people that do that recreationally.
Yeah, so it's usually recreational. So if you get ketamine for a procedure, usually like anesthesiologists will use it a lot, but it's usually those like extremely high doses. Yeah, I mean you can see really young people that need their bladders taken out because they just don't function. So I mean it's unfortunate, but you can see these self-destructive behaviors.
We got to put some signs up at like a rave because the rave girls, they're doing lots of ketamine.
Is that I'm a little
I'm telling you,
I'm out of the rave scene now.
The EDM scene, man.
Really?
Yeah, they're doing some ketamine. Yeah.
Because back in my day, it was actually I don't think I've ever been to a real rave, but I've heard. So it was what was it, like ecstasy, speed, and people was the candy? Do people still do that?
They still do that, yeah.
It was like the big parachute pants and the candy and the lights, the glow sticks. Are the glow sticks still
I don't know
popular?
about the pants. I think everything else is still there. Definitely the lights, definitely the candy.
But now it's just ketamine.
Yeah, and they're doing that, mixing a little ketamine in there.
Okay.
So I've heard. I don't go to ED. It's not my scene. It's not me. But.
No, I appreciate doing stuff like this because I'm so out of touch with pop culture and stuff. So I like to learn.
Yeah. Well, that will make sense though. That's crazy that they gotta be careful, dude.
Well, so I mean, but like, we'll probably as a society start seeing the ramifications of it then at some point. I mean, one of my colleagues, I think she has one or two cases. Like she's told me, like it's starting to show up more in Wisconsin. I mean, it was a kind of a rare thing only for exams, but I think it's potentially starting to show up more.
Yeah. Wow, dude. That's So guys, stop taking.
So don't be like
Elon. You
Elon.
Learned anything?
In a lot of ways, but no ketamine.
What are like the most? So, I'm interested in like what are the most common things that you see, like issues that you see, maybe that aren't like as threatening as a kidney stone. For like, we'll do women first and then men.
Yeah.
I'm interested in like the differences.
Yeah. So things that for women, recurrent urinary tract infections is huge. Incontinence of urine, so leakage of urine. I would say those are probably the two most common.
Yeah. And how do people get UTIs? So like, because I feel like people can get them so regularly sometimes.
Oh, this is a subject I'm very passionate about. So.
Okay, good.
I know it's kind of so. It's interesting. So urinary tract infections can just happen spontaneously in women of all ages. Kids can get them. So sometimes congenital like kidney issues, something called reflux, where the urine doesn't stay in the bladder. It actually goes backwards up into the kidney, can cause febrile or fever.
Why would it do that?
The mechanism, so our bladder is designed such that when you squeeze the bladder, because the bladder is a muscle to urinate, it's supposed to pinch off where the urine tubes plug into the back of the bladder, so the urine doesn't go backwards. If that mechanism is messed up somehow, that's called reflux, so it goes backwards. And so it can actually destroy the kidney, can cause urinary tract infections. A lot of it is also, there's a lot of what's called dysfunctional voiding. So what's a really unfortunate aspect is that you see this in men and women, and our younger people who've had a lot like military sexual trauma or any sort of sexual trauma, or as a child, they were humiliated for wetting the bed, holding urine, or saying, I mean, you hear things, people can sometimes say like, oh, I had to go to the bathroom so often as a child, and I was made to hold it. And this profoundly impacts people, and they learn these voiding or urinating habits where they hold their urine, they don't empty enough. So this can be really, and this is part of the psychology of urology, is I like getting to some of the roots of these issues, because you can change, you can make people's lives better if you can actually, as like an adult, teach them how to urinate again. And again, I think this is what's fascinating about it, is that we take urination for granted most of the time. And sometimes people just, it's not anything wrong with their bladder or their muscles. It's just they have learned these habits that we try to help them unlearn. So that can be infected. And then in older women, it is menopause that often cause it. So that is a huge, huge, huge cause of morbidity. So basically people going into the hospital, antibiotic use. So it runs the gamut across. But I would say primarily structural issues, including things like constipation. Constipation is a huge deal in causing urinary tract infections, just because it can change the shape of the bladder and change the pelvic muscles. And then just natural changes from menopause as well.
So girls should poop sometimes.
So yes, absolutely. That's a lot of what we do is poop management, basically.
Wow.
In urology, and especially like pediatric urology. Like I don't see kids, but that's a big part of it is constipation management as well. And men too. That's big. As men get older with prostate issues, that's a huge deal as well.
Yeah.
So bowel habits are very, very important.
So it's in for men then, is it like, what are the things again that are similarly like that you see all the time that aren't so life threatening? But
so prostate issues probably in men, and erectile dysfunction. So prostate issues, so the prostate's a gland that actually helps make semen. It actually produces most of the semen volume is from the prostate. So actually very little of it is sperm, but it's mostly from prostatic secretions. That organ grows as men age, or doesn't sometimes grow, changes shape, but the urine channel essentially runs through it. And that can pinch the bladder off. It can grow very large. It can go to the extent where guys are having infections. They're having to go to the ER to get catheters, hurting their kidneys, miserable quality of life.
Why does it get bigger?
It has to do with testosterone as well, in a certain form of circulating testosterone. But I think a lot of it is we don't actually know necessarily, and people are still working on why people grow a prostate larger than others. And some people grow huge prostates and they don't have any symptoms. But I think there's some family history that can contribute to it as well. But I think a lot of it's just like, it's kind of luck of the draw. And I think there's still a lot of people that are trying to figure out why benign, and this is not cancer, but like benign prostate growth. So that's a big part of men's health as they age. And then erectile dysfunction is a big deal. And that runs the gamut of psychogenic, like we talked about. Like nothing kills an erection faster than thinking about losing an erection. To actual, like, it's actually considered almost like it's a sentinel event, they call it, is that because erectile dysfunction in men can signal that there's underlying heart disease, because those small vessels of the penis are affected more quickly than the vessels of the heart, and that could be a sign that those arteries are becoming plaque filled, or basically starting to get blocked off, so to speak. And so you're supposed to, so you see it a lot in people with diabetes, who those nerves are, but sometimes people with heart issues, like heart. So erectile dysfunction, I mean, it can be a source of embarrassment for people, obviously, but it can also be a sign that something else is particularly wrong as well.
Is there like when people, erectile dysfunction being such a mental thing, there's all these products now.
Oh yes.
People are getting over the counter. Dude, I'm 25. My shit, or 26. My shit's working fine. Not to flex on people that have it worse. It's working great. I'm happy.
That's
with
good.
Which is great. But I'm 26 and I get ads for this shit. Like targeted, and when I was getting them 4 years ago, when I was 22, I was still getting them. They were sending me ads like, this brand, this brand, this brand. They're like, discreet packaging, over the counter. You don't even got to talk to a doctor. We have our own doctors that will.
It's terrible. So things like Hims. This is. I think that, so this is another thing that kind of grinds my gears is that we have a system that, because there are a lot of young men that do have erectile dysfunction. I see a lot of them. And sometimes it is an underlying issue. It can be from pelvic trauma. So like guys who are in military accident can damage some of the arteries with that. But a lot of it is psychological, but some of it is like organic, like as in you need meds. So the problem is they take part in these vulnerable populations. They treat it as an embarrassing issue, which we shouldn't treat it as an embarrassing issue. And people come in and they're like, "Oh, this is really." I'm like, "Bro, it's a urology clinic. We've heard and seen it all, right?" So like nothing you tell me is going to make me blush.
Yeah.
And then sometimes they tell me something that makes me blush.
Yeah, sure.
No, sometimes people always top it, but like in seriousness, it's not anything to be ashamed of. But the problem is you take these vulnerable populations, low T and so low testosterone, erectile dysfunction. So a lot of the products don't work. A lot of them, so like over the counter stuff.
Yeah.
A lot of them can have really like gas station erectile dysfunction supplements will sometimes contain, I don't know where they get them, like the same ingredient as like a Viagra or Cialis as well, in unregulated and unknown amounts.
Yeah.
The HIM stuff, or those online places like New Mail or these other testosterone clinics, like they are some of the sketchiest businesses at times as well. Like they're not urologists doing it. Yeah. They're not endocrinologists. Like it's people who have very minimal training in managing testosterone or erectile dysfunction. And those can be, so testosterone, because the problem is, we have a lot of, your testosterone should be in the 7, 8, 900s, and like
I see that. I'm big into working out, and I see like guys talking about T levels and shit. I have never once in my real life tested my T levels or had a real conversation about it, but I see it online that people care about it. Like what is this conversation?
Oh, so this is another thing that the problem is testosterone, geniusly or infamously, I suppose I should say, is that marketed like, are you tired? Do you have a low sex drive? Are you gaining weight and have low muscle mass? Like things that are very common to everyone. And there are myths like in the gym that you hear about it. There are wellness influencers that sell this idea that your testosterone needs to be up, where in reality, there's a lot of guidelines exactly what range it needs to be. You need your blood counts monitored because testosterone can thicken your blood. And this is the issue for people who buy testosterone like in a gym or out of someone's trunk. Like no one's checking that. Or I'll see people who go to these clinics and they're not getting, I say, are they drawing blood on you? Are they checking X, Y, and Z? No, they're not. Same with erectile dysfunction stuff. People will get sold. So one of the medications it sounds worse than it is. Injections you give yourself into the penis to medicine that actually works on the tissues of the penis itself.
You take a needle?
You take a needle.
How big?
It's pretty small. It's like a little insulin needle.
And it goes in the penis.
Goes in the penis, and it works really, really well. But if those medications are not prescribed properly, you can induce the classic erection that lasts more than 4 hours. And people, that's an emergency. So sometimes these people aren't told, they're not counseled appropriately. People don't know the doses to take. They're not told how to take it. And that's an emergency for urology as well, because that's a heart attack for your penis, basically.
Yeah. Yeah, what happens when you're hard for over 4 hours? What starts to happen?
So it's funny because when you talk to some patients in clinic and you're like, and if you have an erection lasting more than 2 or sometimes 4 hours, like go to the emergency. They're like, well, that sounds amazing if I have an erection that lasts more than 4 hours. And
sounds
you're like,
inconvenient, man.
It's inconvenient, but it's extremely painful, but it's also, you're not cycling the blood out of it. So that blood starts becoming deoxygenated. It's like an overworked muscle and the tissue actually starts to die. And so
that's like holding a flat, or like go do a wall sit for 4 hours.
Yes,
what's going to happen to your quads?
Exactly. Your quads are probably, you're going to develop like a compartment syndrome. So it's like like basically blood can't get blood.
Oh my God.
Yeah. So it's extraordinarily painful, but it can really, really damage the natural erectile mechanism forever from it.
Yeah.
So these clinics have to be very, very, very carefully managed. And a lot of the problem is they offer them with it's not embarrassing for people because you can get it online. Yeah. These meds are reformulated in chewable form, but they're basically like the old meds, just kind of either mixed with another one or repurposed. One's chewable versus you had to swallow something previously. Yeah. And you can get them in the comfort of your own home. But I would say, if you are interested in testosterone erectile dysfunction, see a urologist or endocrinologist.
Yeah.
Because our goal is to do it safely for you. Yeah. And we're not going to, you shouldn't feel embarrassed ever.
What about these, you heard about the honey packets? You know what that is?
No, what is that?
These kids I'm telling you, these people, young people
Again,
on TikTok.
you are connecting me to pop culture. I appreciate this.
Somebody brought us one. I don't know where it is, somewhere in here because I'm not eating that. But it's a fucking packet. It's like It's like a thick honey. They like cut it open, and you just like, and it's supposed to just. It's not necessarily specifically for man or woman. It's just supposed to make you horny. It's from the gas station. Like people buy it from the gas station, almost like a gas station boner pill. But it's a honey packet. So if you look up honey packet slang, let's pull it up right now.
Yeah.
I don't want to see results of anything, but we gotta. Yeah. We gotta.
This is very interesting because I feel like getting to know like some of the products on the street is all. I mean, it's good for like clinical practice.
I'm gonna find it too. I'm gonna grab it before because I'm gonna fix that light too. I'm gonna grab this because this is.
Yeah. Oh no, it's
honey pack slang. What is it, or what is a honey pack? Dude, it's gotta be.
See, I can. I can look. Let's see. Oh, so this is one right here?
This one right here. Literally, Mike brought this months ago, and I'm never going to touch it. So
let's see.
Let me fix his light, too, real quick. I want to fix his light.
So as I
don't know what it says in there. It's like in a different language on the back, the ingredients.
The FDA has issued warnings.
Oh, they've directions. Take one every 2 days as needed. Oh, it's made in Malaysia. So let's see. Ultimate power. So, VIP. That's amazing. Yeah, this is no, I've not heard of this, but this is great to know.
You should take that back to the lab. Analyze it. Run it through whatever you got to run it through.
That's crazy. So I am using a light on my phone to read because I just got my first reading glasses for script. So I've just become one of those people that like now has to read a restaurant menu with So I'm becoming.
You like do the zoom in on the phone?
I think I might because I'm trying to learn what's in this. Yeah, it doesn't look like any of these are standard ingredients. So but this is very good to know, and it really just looks like a honey packet.
Yeah, and so
or like mayo or something.
Again, it's like one of these things where it's like I don't know. Hopefully, I don't have to take anything like that in the very soon future or anything to maintain an erection. But that's like a thing that people around my age or younger, are like doing.
Yeah.
For fun, and I'm like, that's gotta fuck you, especially like if you're able, right? If you're able right now to get a boner.
Has anyone told you why they might do that?
Apparently
or
it's just supposed to. It's like
makes you some sort of like
they think like they
sexual
better
god kind of thing, huh?
And I'm like, I just don't know. Like I don't know. So, but it's just like if you're already able to get it, that seems like something that would be really scary to mess with. Especially with like how everybody knows like Viagra is like the most prescribed thing in the world, that it's like we all know that does become an issue for many men as they get older.
Sure.
Why would you, while it's working good, jack with it, like fuck it up so that maybe you ruin it sooner?
I mean, I think this is a problem. I mean, is that from a societal standpoint, obviously we're probably telling people like unfair standards about sex. People watch pornography, and that sets a terrible like this is not a pro or anti or pro porn rant. It's more just like, if you think about it just as a medium, it's like sexually you're setting all these expectations that are unrealistic for people. How much does this cost?
I have no idea. I have no idea. Can we look
I was gonna say you didn't.
That's what I'm saying. It was literally handed to me. Like he would help with the podcast sometimes, and he just literally dropped it off one day.
That's
and I was
crazy.
Like, what the fuck?
Well, it's because like that's the problem is these supplements are unregulated and they're expensive.
So we can see this, so people can see what. Yeah.
It looks like a 12-pack is about $15.
A 12-pack is $15.
Okay, well,
so the gas station's probably selling that one for like $2.
Huh. That's interesting. Which is, and it's, I mean, I don't know what any of these ingredients are, but they're not anything that I
That's not a good sign.
have
when we've
studied, I guess, generally.
That's not a good sign. That's insane.
That's very interesting.
Yeah, it's stuff like that.
So have you talked to anyone who's taken?
Oh, I know people that take it. Yeah.
Well, I mean, and like, or
they just said that they think that like it's
does
like
does it work, or like
I didn't get into like yo, how was the stroke game? But I was like, why would you do this? Was my question, because I feel like I'm the sometimes like the wet blanket for a lot of my
sensible
friends.
one.
Yeah, like my friends are like they tell me some shit that they did. I'm like, just why though? And so like I was just like, why? And it was like, dude, it feels better. You're going harder. You're going longer.
Interesting.
And I'm like all this stereotypical shit that like any one of these other ads would run.
Huh.
So yeah, I don't know. It freaks me out, but that's actually hilarious. I didn't even forgot that we had that. But then when we started talking about hymns, I'm like, yeah, dude, because that shit. You see that stuff advertised so much, and it's like on like every dude podcast, like every
I mean, I think it is taking. There's
Blue Chew's the other one. Like,
yeah,
people do like
vulnerable people who are embarrassed, which they shouldn't be. But it's like, I think if there's one, not buying a honey packet and seeing a urologist, I think like, that
might be more.
We are happy to help with these kinds of things. Yeah,
yeah. Gosh, dude, that's What's something that's weird now, or maybe you didn't expect doing what you do, and maybe as you were like getting into it that you maybe wouldn't have expected would be the case? What's something that surprised you being a urologist or just even, practicing medicine in general?
Yeah. It's a great question. Because
I feel like there's got to be like, you probably have different expectations and ideas of how it will shake out when you get into it.
Yeah.
And then you get there. And I mean, it's like anything in life, right? Like you're like, oh, I want this thing, I want this thing, I want this thing. And then you get it, and you're like, oh, so this is what it's really like. Like what was it for you?
I think it's kind of, it's very stereotypical, but the amount of paperwork that there is. So I always thought about when you have a show like House or something like that, and it's always, or a medical show, and they're like, get the patient to the operating room, and they're just in the operating room the next. I mean, they don't show that you have to talk to the front desk for the operating room and say, when's the operating room available? And they say, oh, we have 3 cases going now. Is this an emergency? And you're like, well, it's not an emergency, but we should do it today. And they're like, well, maybe you can go in 4 hours, and you sit waiting, and then you have to consent the patient. So give them the paperwork. And there are so many little things and check boxes that are it's sometimes so little of your day is practicing medicine. I sometimes just say medicine is like you're a very highly trained like customer service agent at times as well. It's like you're filling out forms and paperwork, and sometimes just to get a patient to the operating room where they like, just please, like, let's give them the care they need. That can be just a mound of paperwork.
Grind of just busy work,
Exactly.
I mean, important. I'm sure a lot of it's important, but like, it's got to feel like it's not the thing that you necessarily are passionate about doing.
Yeah, you didn't think you'd be doing a lot of it. And I mean, yes, notes are important, but the problem is, and this is a whole, you could have a whole other like podcast series on this, on like requirements and paperwork and boxes to check and yearly trainings and such. It's like you're not doing actual medicine for a lot of it as well.
That makes sense. Yeah. I mean, that's gotta suck. That's gotta be, I mean, just frustrating part of it. As you've like now been doing it a while, how long have you been practicing?
So I've been on my own as like a real life urologist for about 4 years now, and then I was a resident at so you're a doctor, but you're in training, so you're supervised. So that was 5 years. So I guess total like almost 9 years now.
Yeah. Wow. What's like maybe one of the craziest or maybe worst things you've seen?
Yeah. Okay.
We don't got to violate HIPAA or anything.
No. I mean, we'll talk about it in general. Bad things that you can see. So Fournier's gangrene is a bad one. So this is kind of this is a flesh-eating bacterial, like kind of necrotizing infection of the perineum, so the area behind the scrotum.
Wait, what is this? This is
have you seen those commercials for like certain, like I think it's meds like Jardiance and such? So sometimes they'll say things like may cause like an infection of the perineum and the scrotum. So in urology, or kind of one of the most emergency complications is that you can develop a life-threatening infection of the perineum, the scrotum, the groin.
Perineum, is that the
The taint. Yes. Yeah, it's the technical term for it. Yeah. Sorry, I don't know why I.
We're here. It's
the taint. Yeah.
Okay.
It's a taint infection essentially.
Whoa.
And the key is that is a life-threatening emergency, and that is like you clear the operating room and you go and you have to cut as much infected tissue away as possible. Yeah. So sometimes you are taking all the skin of the perineum, skin around like the groin. You take people's scrotums off. You take the skin around the penis off. Like it can be very, very, very debilitating. So that is kind of your classic.
How do you get that? Just not washing your balls, or like?
So sometimes it can be. Usually it's poorly controlled diabetes. Alcoholics can have a propensity, can be more prone to it. I'm not sure of the exact mechanism, but like when they test you, it's like alcoholism is a risk factor. I wonder if it's like poor nutrition or like blood sugars management. Is that you can't fight off these infections? So sometimes it's like people will say, I had a pimple on my groin, and then 3 days later, it's now blown up into this. So. That is like your classic urology, like life and threatening infection. And
it
you just have
happens.
Yeah. And people will sit on it, unfortunately, and then they come in, and sometimes they can be very, very sick. But it's just that's like an actual that's an emergency.
Yeah. Wow. You ever have to do like a adult circumcision?
Yeah.
Really?
Yeah.
Whoa.
So that happens a lot, actually.
Interesting.
So adult circumcision happens just for cosmetic reasons. People just want it. But sometimes people are having, like during sex, they'll have actual like tearing of the foreskin or tearing of the frenulum, which is the area on the underside of the penis that connects the foreskin. But sometimes you'll have a condition called phimosis, which is where you cannot retract your foreskin. And that can be that can be an emergency if you can't get if someone can't urinate, can't get a catheter in. So sometimes we've had to, in the emergency room, we'll have to do what's called a dorsal slit, where you actually make a slit on the top of the foreskin to expose it enough so you can get the glands or the head of the penis exposed. Yeah. Sometimes there's penile cancer under there. You'll see that. Like that's extremely rare, but it does happen. Yeah. Then the counter of that is something called a paraphimosis, where it's actually the foreskin gets stuck behind the head of the penis and swells. So it's basically kind of clamping it off. And that's an emergency as well.
Whoa, dude. So then you have to cut it
Yeah,
off.
so basically the key is like, actually it's like you squeeze for a while to get all the like swelling out, and then you try to kind of just like pop it back, like kind of pop the foreskin back.
Jesus Christ.
Yeah, but you need sometimes you need to go to the operating room, or you need to actually cut the foreskin to get it back. Yeah.
Wow, dude.
And that can be really bad in people with like diabetes, like who don't have like good sensation. Like some people don't realize it, or like bedbound patients with catheters, like they're getting their catheter checked at their nursing facility and someone forgets to put the foreskin down. Yeah. Like, so yeah, those are.
Wow, dude. That's like.
Yeah.
What's the recovery like on that? Because full transparency, and I've talked about this before, so I'm not embarrassed to say, but I'm circumcised. My mom got a lot of hate for that. She was on this podcast a long, long time ago, and there was a ton of people online that were like super mad at her for circumcising me. As a baby. So like, there's a lot of people that like will never have to do that. I don't know what it would be like as a conscious human being, because I have no idea. I don't remember.
Exactly. Right.
As a conscious human being, like having to get that shit cut off of me.
Yes.
And then go home.
Yes. So it's interesting because I sometimes just out of there's this whole movement. I think some of them are actually called the intactivists.
What does that mean?
Like, so they're like very pro intact foreskin. There's a documentary on Netflix. Yeah. You see it online. Like I will just sometimes read the Reddit forums just to see these like alternate viewpoints. Yeah. Because I think like when you think of it, like, yes, a lot of people think of it as like genital mutilation. Which is a whole other issue. But like when you're a urologist, you see it. It's like it can be an emergency. It can be a source of chronic infections. So like sometimes circumcision is a really like important. It's really important. It does help prevent. It does have health benefits.
I was gonna say, people say, and this is, I'm just speaking in myths. Yeah. I see a lot of people, whether you've ever watched pornography or not, you'll see people in the comments get very sensitive about it. You see it on Reddit. People are like super sensitive about it. Like, sure. No, you shouldn't be circumcised. Blah, blah. People you could find, there's videos on this YouTube channel of my mom getting so much shit.
That's crazy. Your poor mom.
People are like, that poor child. He's never gonna know what true sensation is because he was mutilated and da 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 da. And I'm like, I have busted many nuts. I think I'm okay. It feels okay still. So
yeah, I think that's the thing. Is like, okay.
But then the other side is people say it's cleaner, and then other people are like, that's not true. It's
just like learn to clean your. I've heard to like learn to clean your. Well, it's like sometimes it's so tight you can't pull it back.
It does seem, and I don't mean to shame anybody that doesn't have it or is uncircumcised. It does seem like a hassle. It seems like an extra. I'm not saying there's anything wrong with it, but it does seem like, okay, if I wanted that, I would have to do some extra, scrubbing.
You do need, and I mean, I think it's some people. I mean, some people are just never taught how to do that. Yeah. So it does and there are some actual health. So being circumcised helps prevent. You have a lower risk of penile cancer. Penile cancer is extraordinarily rare. But chronic irritation, inflammation can cause tumors of the penis. Lowers HIV risk in men who have sex with men. They've studied this in other countries as well. So it does have some documented, and I'll probably get a lot of hate for it, but does have documented, actual, scientifically proven health benefits.
Yeah.
This is not an argument of aesthetics or sensation, so hopefully people commenting on this can separate the actual science. And also, like I said, it can be an emergency because you cannot get a catheter in, or someone can't urinate, or the foreskin is stuck behind. If you have someone who's in a nursing facility with dementia and they have a catheter in their bladder and they're having their foreskin left behind their penis, and then it can't be because it gets so swollen. That's so there are actual
real benefit, regardless of your preference or what your parents chose to or not do to you. There's some science,
and that is how I'm approaching it. Is there is actual science behind it, and whether you're circumcised or not. But we see people of all ages who come in for circumcisions, chronic infections of the foreskin, of the glands.
So what's it look like if a 26-year-old, 27-year-old goes in, gets some, little work done, circumcision? What's that like recovery? Is he good a couple days, a week, month?
Yeah, usually it's very, very well tolerated, the surgery. It takes about 30 to 45 minutes. You go home same day. We basically say no sexual activity for a couple of weeks. There'll be some swelling, some bruising, but it's very, very well tolerated.
You ever have anybody they go home and they tried beating off right away? And
I don't know if I have. I'm trying to think. I have had people who have kind of popped the sutures, the stitches on it for one reason or another.
God, guys,
which you actually, a lot of it is just you're just we can just observe it. You don't really take them back to the operating room to restitch. Yeah.
You just kind of watch it.
You kind of just watch it because the penis heals fantastically well. So as urologists, I will say we are very fortunate enough to operate on extremely resilient organs. So bladder heals great. If someone perforates their bladder and we have to sew it back together, heals awesome.
Yeah.
Scrotum, penis, testicles, excellent blood supply. Testicles have 3 blood supplies because they have their own blood supply. With that infection we were talking about, they're often not involved in the infection, so you can often leave the testicles. Yeah. Which then prevents future issues because people will have their testicles flapping in the breeze, afterwards. You have to figure out how are you going to protect as they heal, that kind of thing as well. Yeah. So sometimes we'll tuck them into people's thighs, called a thigh pouch.
So you put their testicles in their thighs.
Yeah, basically kind of make a little pouch
because you had to get rid of
skin.
the scrotum because of the disease, the flesh eating.
Yeah.
Wow.
Yeah. So
how does that work when you sit down? Or it's in the
they're kind of on the inside.
Wow.
Yeah. I mean, there's all sorts of reconstructions. People, you can make a new scrotum out of a graft, or sometimes you can use skin that's left over. So there's things you can do for sure, though.
Wow, dude, that's intense,
right.
Man.
So it's a very wide-ranging field. That's what I mean. It's a lot of people think it's penis, but it's
there's a lot in there.
There's a lot in there, which is why this is it's so it's why I really like it. Yeah.
Well, there's a lot. And not to get all controversial with this circumcision. So this next thing we're gonna bring up, it should be maybe. I don't know if this will be less controversial. I think it should be less controversial. Do you want to close the honey pack tab? You can open the other one up. This is something that's been going on, and I figure since you're a urologist, this might be interesting to show you. So this is #dworking. So you've heard of twerking?
Yes.
Right? We know what twerking is. People shaking ass and having a good time.
That I actually do know what that is.
Yeah. There is a new trend going on where men, they're dworking. So they're dick twerking.
Oh,
click the first guy. Click the first guy. He's no, to the right, Yeah. We don't need sound on though. No sound because I don't want us to get copyright claim. No sound. Just watch his moves. You don't have. The music is great though, but this is the move. So you hit a little.
So they're basically like oscillating their penis back and forth.
Yeah. Here, give him.
Interesting.
Let's do. Click one of the other ones here. Maybe I'll do it with the sound for like a second or something, so that we can go to the top five dworkers. Yeah, do the top up. Yeah. Ranking the best dworkers.
This is
what they do.
I am so out of touch with pop culture. I had no idea this was.
Do you think
thing.
this is, as a urologist, is this healthy? Are we in support of dworking? Is this a progress or is this regression?
I mean, I think as long as you are so I could say this, like lower, like wrist things, like as long as you are doing it with an erection could be potentially dangerous because people can fracture their penis, actually.
Whoa.
Yeah, you can. So usually that needs a lot of force, but you could probably put some tension on it, and there's a ligament sometimes or rupture called the suspensory ligament or rupture of blood vessels. So doing it with an erection. And then I would say lower risk things that happen is that conceivably with movement, you could cause a testicle to twist or torse potentially, like kind of repetitive, which that is I imagine these are very low risk to these things happening. But if I'm thinking about it like from a medical standpoint, like those are the things I would potentially be worried about.
So just don't go too hard when you're dworking.
I think, because otherwise the penis, I mean, like if you're going on a run or something like that, things bounce around, or like if you're playing sports. So I think it's probably low risk for it, but like I had no idea people were putting it on. Yeah,
it's huge weight. Yeah,
TikTok.
go back one more time. Show them the first one. That first one is crazy.
I'm not on TikTok, it's like a good compilation. This is.
Yeah. We dworking all year.
Dworking. So I'm gonna have to ask my former co-residents and stuff because they're a lot more on top of these.
Yeah. Look at that.
So this must be
they say Michael Jackson was the original dworker.
So this must be like the new, because like a few years ago it was it was what, like sunning your taint or your perineum?
We covered that. Yeah, we covered that on the show. Yeah, it was awesome.
Because
I didn't try it, but
I mean that's
super scary, I guess.
Well,
really
that to me seems like a risk of like melanoma, skin cancer. I would not.
I just think it's hilarious that people were like,
going through the effort. Like, because I remember that was a big deal.
There were some gurus that were swearing by it too.
Yeah,
there was like groups of people that were like, no, this is good, man.
No, because you can get melanoma on your penis or like your groin and like that. So
Have you ever tanned in a tanning bed?
I have not.
I only did.
I mean,
I've done it a handful of times.
Yeah.
I don't.
I'm
really
pasty
like to do
white.
It.
Yeah. So
one time I did, and I forgot to like wear like shorts or like anything over my shit, and I don't think it ever went back to the regular color. I think it's a shade darker. It's never gotten.
You've been permanently.
It's never gotten
permanently tanned.
As much as it recovers, I don't know that the outside does. It just stayed.
Oh, maybe that's not. That's interesting.
It's just different shade now. I don't know. It doesn't.
That's
go back.
interesting.
That could be a just me problem. Somebody else let me know. Somebody else let me know. This was years ago.
I was gonna say that's one I have it. I might need to run this by some other folks. Be like, we could write a study.
There could be a new paper about it. Yeah, we could do something. Help contribute. What's like the best advice that you would have for people as a urologist, just for general health, like, so that they don't have to see you that often and there's no emergency that they need to come to you for?
Yeah. So what I always say is that there is probably, like, if you look at it, there's probably not a supplement, a thing to do, or a lot of times I'll get asked about diet or like things. What can I do to prevent X, Y, or Z? I mean, we know fluid for drinking your water, obviously, or your liquids for your kidney stones. But I always tell people is that, like, I think eat well, exercise well, socialize well. That's what I usually say. Like, if you are taking care of the whole body, so mind, body, and brain, and this is not like I don't sound like I'm like going all what do they say, call it woo woo here, but like actually, like if you are of healthy body, healthy mind, healthy spirit, and you have a good support structure, I do think people who have good support in the hospital, whether that's friends, family, a significant other, I mean, I'm always, I guess, heartened maybe or surprised by how often it's like the ex-wife or husband that sometimes will be this main support person. Like, so if you have someone to take care of you, people do a lot better with that if you have a good support structure. If your body is well taken care of, and I'm not like jacked bodybuilder, but if you are like exercising, you're of a reasonably healthy weight, that makes any intervention that we have to do, your body can just withstand it more. Yeah. And that's kind of goes along with the eating well. If you're eating everything in moderation, I don't think there's anything you should or should not be eating necessarily or drinking, it's everything in moderation, but that just puts you physically and mentally in the best position. And then if you needed something, because shit's going to happen, right? Yeah. Like we are not in control. Stuff's going to happen, whether you're healthy or not. And we have a lot of different technologies to take care of a lot of different things. So if you put yourself in that state, like you do so much better than someone who is frail or generally unhealthy, smoking, had 6 heart attacks, like those kind of, that's just going to make it harder for you to go through any intervention.
You're basically just if you have a solid foundation, it's going to be a lot easier to do whatever we got to do on top of that than if you don't, because now we're going to have to try to like supplement that foundation.
Yeah, because it is deconditioning in the hospitals. Like if you ever have to be in the hospital, like people being in bed for just a day or two, like sometimes people are so weak like that they walked before the hospital, they get so weak because that muscle mass regresses so quickly that they're walking with a walker when they leave the hospital. Like that's to me, I'm like, that is like, it just shows that you really have to take like being in the hospital seriously, and that it's like, I think trying to prepare yourself for these interventions is your best bet. Yeah, you owe it to I feel like you owe it to yourself and to your body to just try to take care of it, whatever that looks like, for you. Just try. Right. I feel like, a lot of people don't try. Because a lot of people, I tell people, I'm just like, they're like, what can I do? Because again, I think it's a lot of this is we just want control. So they want me to say like, if you eat your diet low in X, Y, like that's going to lower your prostate cancer risk. And like, it's interesting. The funny thing I often tell people is that I'm like, a vegetarian diet may help prevent prostate cancer, and definitely, probably will help with kidney stones. And like, so when they come to me for diet, when they ask diet, that's the one thing people will draw the line on. They're like, well, I'm not doing that. So like, fuck all that. I am a vegetarian. So I say, I chuckle with that as well. But I think just in general, you can go through a lot more if you are in a good support system, really, too. Yeah. Because those are the people that will be driving to appointments. I mean, they'll be changing your dressings if you need it. They will be helping you get in and out of bed. And I think, too, if you're a little stubborn yourself, I think some of the people that do best are the kind of feisty, stubborn, crotchety people in some ways. Sure. Yeah. Like, because they're ready to go to battle sometimes. Yeah. They want to beat the thing. They don't even know what it is yet. They're waiting for the diagnosis so they can figure out how to beat it. Exactly. Fair. I was joking with a friend of mine. He's long time been on the show a bunch of times, telling him that I had a urologist on, and he was like, "What is that?" I was like, "Okay, not to dumb down your expertise," but I'm like, "Well, he deals with penises and stuff like that." And he's like, "Okay," and so he had a couple questions. Sure. This is shout out to Big Ty here. He says, his first question was, he needs this settled once and for all. Is it possible for him to make it bigger or smaller? Bigger. No, not necessarily. So I would say there's nothing that there are people that will offer surgery, some of which can be very dangerous, none of which are actually proven. Yeah. How does that even work? So there's a lot of like injectable stuff as well, like fillers people will use. Sometimes there's cutting what's called the suspensory ligament of the penis. So like the penopubic junction where the penis connects to your groin, essentially. There's a ligament, so sometimes plastic surgeons or urologists can cut that, and that just allows things to hang lower. Yeah. Would that be more difficult? I mean, I don't know how it works, but like, wouldn't that be more difficult if like your body is used to making an erection, however big, and then you're just like, well, we're just gonna let more of it. I imagine it would be harder. Like you would not be able to kind of have the same amount of blood flow. Or it's what's like the architectural? I can't remember the architectural term, but basically, like you just don't have the support essentially. So I would imagine. The filler one scares me too. What are you injecting in there? Like concrete? And you're not going to feel it it's not going to feel good, I imagine. No, I mean, I think it's like probably kind of like what fillers, like I don't know 100% like fillers for the face, like those kinds of things. Like I've had some people, like they'll do them at these clinics, and those can become infected, and you have to take, you basically have to take it all out as well too. Yeah. Smaller. You don't necessarily make a penis smaller, but there's certain surgeries that we do that smaller penis as a consequence, and not necessarily smaller, but it's just we pull the penis in. So like if you take someone's prostate out for prostate cancer, the prostate sits between the bladder and the urethra, the urine tube. And when we sew that urine tube back to the bladder once the prostate's out so you can pass urine normally, and that's going to put some tension on the penis, so guys will lose some length. Like you're not physically losing length like in actual length, but it just seems like it as well. Whoa. So there's no real like shrinking.
That's got to be hard mentally though.
It can be.
Go home and you were thought you were a solid 6 inches and you drop down 5.5.
Yeah, no, I mean people can actually, yeah. So I mean, and like that's what we tell people. So like another surgery, kind of the last option for erectile dysfunction is putting in an actual like inflatable penile prosthesis. So actual like inflatable device that's like you pump up with a pump in the scrotum. That's an erection on demand. Whoa. That is implanted surgically. It works really, really well. But you have to counsel people very, very carefully, like, because a lot of people would think like, oh, this is going to give me like 12-inch penis and it's going to be 3 inches, and you're like, no, like it's not going to change anything. There's also surgeries called there's a condition called Peyronie's disease. You've probably seen commercials for it. Like it's like the one with the carrot, like the bent carrot. So basically, it's where guys who have trauma to their penis, usually where a plaque or a scar basically bends the penis during an erection, and it can actually bend like so significant that you can't have intercourse. Certain surgeries there to remove those plaques can cause some penile shortening as well. So it's not like an actual like shrinking of the penis. It's more like just procedures to loss of length. There are some congenital, like, genetic things that will cause small penises as well.
Is it true that if you're at a higher or lower body fat percentage that you lose like exterior length because of...
So it can become buried. So a buried penis is a real problem. And that's like something we'll see a lot of. And that again is a big thing as well, is because yes, you can bury, some guys can't get their penis out and they're just dribbling urine. And so that can be a big risk for hygiene issues, for infections, inflammation. And there's a surgery for that. And sometimes we've seen penile cancer on those as well too, like on the pathology, like where you didn't expect it, but like, a chronic inflammatory state. So yes, that's usually a weight and like body fat issue, but sometimes, saying, just lose weight is a very unproductive, because you're not going to necessarily lose weight from this. You actually have to do a really big surgery to actually correct that.
Really?
Yeah, that can be a big deal.
Yeah, it sounds like a big deal.
Yeah.
I can imagine. This Ty's other big question
for
you was how many times, if he's jerking off, is too much? How much jerking off is too much? Or how many nuts can he bust in a month before maybe he should stop?
I mean, I don't think there's any, like, you're
just
not...
go for it.
Yeah, like you're not necessarily going to exhaust the system. From an ejaculation standpoint, you may have some, if you're ejaculating that much, those are the muscles of the pelvis that are really contracting that hard. You may have some musculoskeletal issues. There can be, which can cause some testicular pain or discomfort. The other thing, the chafing, like if you're masturbating that much,
that sounds like it could be.
And if you are putting that much like friction injury on your penis, like then that's probably too much. But like from like a ejaculatory, from your like testicles to the vas deferens to the urethra, you're probably not going to hurt anything. Yeah.
I've heard this thing been thrown around before on podcasts and whatnot. I don't know if it's true, that there's like a certain number of ejaculations in a month for a man that like lowers their risk of prostate cancer.
Yeah, I've heard that. I don't know how good that data is. I don't know the exact numbers.
There's like 20 something.
I've seen it, and like I think the thought is like you're relieving like prostatic congestion, and so I don't like, and maybe I'm guessing
like,
like,
it intuitively makes sense, but there's nothing really substantial.
Yeah, it's not something that you're like, when you're taking your urology boards, they're like, here's something you like have to know. I mean like it's just so like I don't 100%. I've heard that, but I don't know how good that data are on that. Those data are.
What about like guys, I feel like when they go to a urologist, if there's like a sexual thing, right, it's the erectile dysfunction, or it's maybe the cleanliness, or they've got these other things. What is something that maybe women have to deal with in a similar vein?
Yeah, this is a big deal in urology actually. So women who are postmenopausal or perimenopausal will have a lot of, because those tissues of the vagina and the urethra, which are very close together, don't see that normal estrogen from the monthly cycle. Those tissues can become very dry, inflamed, irritated, urinary symptoms. So there can be pain with sex, there can be discomfort, and so oftentimes we can see women for a lot of that, plus the recurrent infection. So treating that is usually done with vaginal estrogen as well,
wow. Yeah.
which supplements everything and restores that tissue very nicely. Hormone replacement therapy is something that's like I don't do as a urologist, but there's a lot of like data now on like, obviously it was previously thought to be controversial because you're like, oh, you're going to cause breast cancer, you're going to cause strokes, heart attacks, and like those data are probably were misinterpreted.
Yeah.
And a lot of women have suffered because they haven't gotten that hormone therapy, the kind of the lore, or not the lore, the kind of is the scientific consensus now. But sometimes, yeah, there's like giving women testosterone is a bigger thing now. Supplement, yeah. So because like all of these are good for sexual health. So pelvic floor issues as well in men and women. The pelvis is a small space, but there's tons and tons and tons of muscles in there as well, and those can become inflamed and like cause urinary issues, testicular pain, chronic pelvic pain. So there's something called a pelvic floor physical therapist who we lean on really. So these are special physical therapists that work specifically with men and women for chronic kind of pelvic pain issues, constipation, recurrent infections, dysfunctional voiding, like holding urine and stuff like that. So
is there like exercises that they recommend or that they
So oftentimes people will say, oh, I do my Kegel exercise, which is like contracting the pelvic floor, but oftentimes that's not because that tightens the pelvic floor, and oftentimes people have too tight of a pelvic floor. Sometimes like those muscles need to actually be relaxed because that's what's causing inflammation. But going to a urologist and having getting a referral to a pelvic floor physical therapist can solve a lot of problems because we see a lot of young guys with testicular pain, and we see young women with recurrent urinary tract infections and pain, and oftentimes like the guys, everyone's freaked out that it's like the testicular cancer or something's wrong, and so it's a lot of reassurance, but also like a lot of, again, constipation management, pelvic floor physical therapy works great.
Yeah. What about if you like people that shake their thing after they pee really vigorously? Is that like a...
I think if you're not erect, like I said, which, I have a lot of guys do that as well. I mean, I think it's just, use common.
Well, sometimes you're at you're at like a Bucks game or a Brewers game, and they don't put dividers up in between those, the fucking urinals, and you're pissing there, and there's just a guy who's just slinky in that shit forever, and I'm like, damn. And I've been there, I've shaken it before too, but I'm not at the Brewers.
You don't want to be
game.
in the splash zone.
No,
right?
That's what I'm saying. And sometimes like the violence at which he's shaking, I'm like, that's dangerous.
Yeah. I mean, I think, right. Like, it's common. A lot of guys will do that because there can be urine that's stuck in that upper part of the urethra dribbling. So oftentimes it is urine that can't get expelled all the way from the urethra.
I've heard it explained, and you tell me if this is correct at all, that like in women, when they pee, it's sort of like they have a thing, it just opens and then pee comes out. And men, we kind of have like a canal, like there's like a door here and a door here. So, this door's got to open and then this door has to open. And that's where sometimes.
So there's an internal sphincter and an external sphincter, and the prostate sits between both of those as well. And the external sphincter is actually the only one under our voluntary control. That's when we relax and contract when it's an appropriate time, socially appropriate time to urinate, as it says in the textbooks. So there's that, but sometimes it's usually a little bit of extra urine that's just stuck in the tube, and it's called post-void dribbling. It's a very common issue. Oftentimes we'll tell people just because we don't have a great solution for it, so people will kind of shake their penis, or you can actually put some pressure on the urethra, because the urethra runs behind your scrotum actually, and just put like pushing behind the scrotum to expel the rest of the urine works pretty well.
Oh wow, yeah. Interesting. Okay.
Yeah. No, we see a lot of people for this. Yeah.
I was gonna say
it's bothersome.
I was gonna say I feel like it's pretty normal. I mean, I feel like I've been there. Everybody's been there, but like sometimes I'm at a sporting event or something, and I'm like, okay, this is.
I mean, it sounds like sometimes I want to go to a sporting event or like a concert and just hand out my card, because you see these people are like the stalls, and you can hear them like taking a long time. I mean, it's like prostate health and like benign prostate and large. Yeah.
Or you ever been to like? I mean, I don't know. I haven't been in a while, but like to like a public gym where there's like a locker room, and there's like these older gentlemen in there, and they're just letting it.
Oh yeah,
they're letting it out. It's all hanging out there.
Yeah.
You try to sit in the sauna for a few minutes, and you're like, all right, the grandfather clock is going. And I'm like, okay.
No, they're very
They're open with it.
no, they're like whatever.
Maybe
fuck
they're
it.
hoping to run into you, and they're like, maybe I can get a free consultation.
I know.
They're like, maybe he'll be around. That's,
Exactly.
Yeah. What have we not touched on? What have we not touched on that we need to get to today? That we need to that you think will be good or funny or interesting in either what you do or in general, if there's something that's on your mind.
I mean, I think it's been great. I kind of wanted just to let it go where it wanted to go.
Feel like we've covered quite a bit.
I mean, what's cool is what I like about the conversation's organic because, originally we were going to talk about comedy, but we talked about urology, which is great.
Yes,
which is awesome. No, this is great because hopefully it answers a lot of questions for people.
Definitely. And what in the comedy space, right? Because I don't know how recently have you?
It's been very
comedy?
recently. I've done nothing of note. I've nothing to plug. I'm trying to just write jokes. I'm trying to do some open mics to try to. And this is going back to burnout and such. You can get very burned out in modern medicine just with the system. I feel like
your work has got to help.
No,
you write. No, or are you able to write from that place, or do you try to write stuff that has nothing to do with it? So it's
interesting. I mostly have been trying to write stuff that has nothing to do with it, mostly because I've been trying to figure out how to actually do it because I never ever want to seem like I'm punching down.
Yeah.
And there are some funny things in urology, but I think trying to figure out how to talk about them more generally and talk about how more they relate to society or anything. But, it's because these are real issues, even if some of them can cause people to chuckle. So it's more like that. So I don't know. I've had a hard time trying to get my...
It's like a moral thing too for you a little bit because you help people. You really genuinely help people with these things. So it's hard to maybe
And I think maybe though, talking about things not anything, obviously you want to talk about anything specific or mock anyone for being in distress, but if you talk about things like fracturing your penis, that could be a funny thing for discussing it in general and how it happens.
People doing some crazy sex, jumping off a ladder onto somebody else?
Usually it's reverse cowgirl is the number one culprit. Yeah, so basically it's the penis kind of coming out of the vagina and then being pushed against the pubic bone.
Oh my God.
So kind of the classic thing is you hear an audible pop, you immediately lose the erection. If you want to Google it,
does it dislocate?
It basically, there's an actual tear in the tissue that holds the blood for erection. So if you want to Google eggplant deformity in your spare time, that's a good thing to know. That's kind of that's the medical term for a fractured penis is an eggplant deformity.
Yeah, I think you've got some material there.
Right. But I think as long as you're not mocking a pig, but it's I think trying the art form is trying to figure out how to talk about it in general.
Yeah.
How to do that because I don't know. I mean, yes, and obviously there's privacy issues, but also things like talking about erectile dysfunction in general, I think would be because it's so I've been trying to figure out how to do that. I think where you can get the most comedy though is making fun of myself as in my training, stupid things I've done, things I've said. Paperwork issues, trying to get patients to the operating room, those more the systemic issues. I think would be funny.
Have you ever when you're I mean I this is probably yes bodily fluid ever
splashed?
Yeah.
Oh God, all the time.
Yeah.
In my face, so a lot of.
Have you had to clean a lot of penises, vaginas?
Yeah. When we're prepping for surgery, I'm a scrotum shaver extraordinaire.
Really?
Yeah. Well, yeah, because of the before surgery, you got to prep everybody, and so that's
impressive. Yeah, that's a skill.
That is part of the job description. Yes, you clean a lot of penis and vagina, but where you mostly get splashed though is not mostly, but where I've gotten splashed is irrigating. So actually, so people will have bleed from their bladders for one reason or another. So badly that you have to actually flush water through to get the blood clots out. I've sprayed myself in the face with that.
Jeez, yeah.
A lot of our cases, when you're in the bladder, you're filling the bladder with irrigation fluid, and then you through a scope, and that just drains. I've just gotten so used to it, being in my shoes and my socks all the time. It's called the urology sock. Yeah.
Okay.
So I don't really care anymore now. I'm it's just part of part of the splash zone, so to speak.
Wow. Yeah, that's what was it like this might be naive. What was it like the first time you had to examine somebody and maybe move it over, you know.
Somebody
else's junk, man or woman, that isn't in a sexual way, right?
I mean, you realize these exams are quite you don't even know what you're looking for. Like, I mean, things like rectal exams, right? Like, you know, for the first like X, like big numbers of you don't even know what because you don't know what normal is necessarily. So you don't necessarily know what abnormal. So you do a lot of these exams and you're like, I don't know if what I'm feeling is normal, abnormal. But now once you like obviously get them down, I can tell much more like what's normal, what's not.
Yeah. That's like a prostate exam, right?
Yes.
Mm-hmm. How often do people go in for those, by the way?
So it's, I mean, that's a whole other.
Because that's like once you hit a certain age, they're like, oh, you got to come in.
This is like this is a whole other issue. Is that it's not as it generally probably isn't used as what we call a screening tool anymore. Like, because it was good. Like when we used to not have certain blood tests or certain like MRIs for like looking for prostate tumors, it was oftentimes the only thing people had. Yeah. I think it's still good if you need to know the size of someone's prostate and they have no imaging or pictures of their prostate. Like you can do a check and that gives you an idea of like, is this tiny, large, like that kind of thing. Sometimes you still do find prostate cancers on people with that. Yeah. But whether it's a routine or not is up for debate at this point.
Oh,
yeah.
Wow. Okay.
Probably
so
not.
Stuff now.
Yeah. Because we have, so we use prostate MRI a whole bunch of time, which is like, if you're feeling the prostate with your finger, you're only feeling like a small percentage of it, the outside of it. And some guys have such big prostates, you can only feel like the lowest part of it. So an MRI is going to be much better than my finger.
Yeah. What do you, on a prostate MRI, is that just like, do I just like sit in a thing or?
You lie down and it's an MRI of your pelvis
great.
And it's specially configured to look potentially for prostate cancer in there. Wow. Yeah. So it's used as part of the whole prostate cancer workup. It's a tool that is one part of it. Yeah.
Wow.
Yeah, it's great. It makes huge difference.
Yeah, that's got to make a huge difference. I can't imagine like even if you did find a tumor with your finger in somebody, it's kind of like at that point, if it was big enough for me to discover it with my finger, then we might be in trouble here.
Exactly. So that's the thing, right? So yeah, because like you want to try to find tumors in asymptomatic men that aren't a problem yet. But yes, sometimes if you find it with your finger, it can be really, really, really bad.
What happened? This will be. I don't want to keep drilling. I feel like I'm drilling you with a lot of stuff. So I apologize.
No, it's been great.
But what is like? What happens if and when somebody does have to get their prostate removed?
Yeah.
So like if you find something, for whatever reason it's got to come out. Like what are going to be the side effects or consequences of that?
Yeah. So we do it robotically, so with tiny incisions and arms that we control.
Like the surgery on a grape thing? Have you seen that?
Yes, exactly. That's basically it.
Dude,
yeah.
That's awesome.
And so it's one night in the hospital, but basically things to expect after it. There can be leakage of urine because we disrupt a lot of the pelvic muscles and the prostate holds a lot of urine in men. So guys will take a little bit to recover their continence, we say, or sometimes not recover it. So everyone's a little bit different in that regard. That can be a very challenging part of the recovery for patients. Erectile dysfunction, because those nerves for prostate for erections are run along the side of the prostate, and you have to peel them off, and they're stunned basically because they basically get swept off the side. Sometimes we have to take them out because we're concerned the tumor is going into those nerve bundles as well. So sometimes people won't recover that. There can be penile shortening after that, like we talked about, because we have to pull everything back in. But I always tell people it's a lot easier for me to fix erectile dysfunction than it is cancer left behind. And like there are surgeries and methods and ways of fixing all of this after in the postoperative period. But it can be a very, like that's why it's a big discussion for me, because it's going to change a man's life for sure.
Yeah, it sounds like it. What about, because like the prostate is like the male G-spot. That's
yes.
What, you hear that all the time. So like if you remove it, they don't have that anymore.
Yeah.
Done.
No, I mean, I think it's like, I don't know how many people have looked into it. I mean, I wonder if like you preserve a bunch of nerves on the side of it, like could you still potentially, I don't know, it's a good question. I have to look into it, but yes, male G-spot would be,
it's gone.
It is eliminated. Yes.
Wow. Yeah, they get nerfed. That's not cool.
Yeah, I know.
That's not good, man. You guys are doing crazy shit, dude. Crazy shit. Well, I appreciate you taking the time, man.
No, this has been so much fun.
Yeah.
I mean, I really enjoyed it. Yeah.
Good, man. I feel I hope I wasn't just like quizzing you the whole time. I mean, I know we definitely learned a lot. At least I feel like I learned a lot.
I mean, like if it's, I mean, I think the main thing is if it helps people not be embarrassed about going to a urologist, discussing these issues. Like I said, we've heard. If we've not heard it all, we've heard a lot of it.
Yeah.
Don't be afraid to come
Is there a spot that people, because we'll link it below, is there any place you'd like people to go? I know you say you're not like plugging anything right now, but like for the comedy, is there anywhere?
Oh yeah, so I have an Instagram. Yeah. It's stream of comedy. So stream _ comedy. And so basically I try to post a joke every day that I'm writing, and it's like I get very not many people see it, but you know what? I don't care. I'm just gonna keep plugging along with it, right?
We'll link it down below.
I
like stream
that.
of comedy too. It's strong stream.
Exactly.
Is that important? Sometimes people will say that. Not to get because you can't, but then sometimes people will be like, "Oh, that's a strong stream."
So like urine stream?
Yeah.
So basically it's if your stream is disappearing, it can be a sign that your prostate is obstructing your bladder, or there is some other obstruction going on. So yes, a strong stream, there is some natural decrease of stream with time, but it can be, I will have some guys like it takes me 15 minutes to urinate. I have to sit down, I stand over the bathroom, I trickle urine out. So yes, it can be a sign that there's obstruction.
Yeah. Oh, okay. Wow. That's legit. So strong stream is good.
Strong stream is good. Like so in young dudes, it's usually a scar in the urinary tract called a stricture that causes it. In middle-aged, older dudes, prostate. And then if you've had surgery on your bladder or prostate, or had your prostate removed, there's other conditions that can cause it too, that can be obstructed. Yeah. But if your stream is noticeably slowing down, it can also mean too that you can't push the urine out of your bladder for some reason. So not necessarily a physical obstruction, but can the bladder not squeeze? So yes, if you have a weak stream, it's definitely something to check out. Something to check out for sure.
But stream of comedy.
The stream of comedy.
Yes,
exactly.
Is where they should go.
Which hopefully that's not a weak dribbling stream.
yeah.
So hopefully some people think that's a.
Well, no, man.
It's a good urinary stream. No, thank you. This has been so much fun.
Yeah, it's been a good time. I want to say thank you to everybody who is tuned in or watching the live premiere, or people that are listening or viewing days after over on Spotify. I want to say also a quick shout out to our patrons. They're up on the screen right now. If you guys are interested in getting behind the scenes access to extra podcasts, extra videos, as well as a series where I break down how I mix and master, write, record every single one of my songs, go to patreon.com/Darren Rita, and you can help support the channel for as little as $1. Also want to say a quick shout out to Alpine House 2 and Impulse Cameras. Shout out to both of them for sponsoring another episode of the show. All their stuff's linked down below too. And with all that stuff being said, this has been episode 315, I believe, 314, 350. I think it's 315 of the Detox Podcast. I will see you guys next week. Peace.